Brian Schatz. We're all senators.
What happened, Corey?
I
don't know. I think we're back on. I think I touched a button. Esam, how are you, sir?
Good, sir.
So we're actually going down to see if we can get the Republican health care bill. Do you know anything about that? No. Well, right now there's a big people are voting on health care for the United States of America, and we don't have a copy of the bill. We're United States senators, and we're going to vote on a bill within days, and we just don't have a copy of the bill. Is that kind of? What do you think about that?
Yeah, man, I don't know.
You don't know? Well, thanks, Esam, for giving us a lift.
Yeah, thank you, no problem.
But maybe Senator Schatz or Murphy can tell us more why this is absurd that we don't have a copy of the bill and what we're doing.
Well, just to give you a sense, I mean, for the Affordable Care Act, whether you like it or you hate it, they had hearings and they had an amendment process, and everybody knew what was in it. Listen, President Obama actually went to the House Republican Conference and got in an argument with Paul Ryan, a diplomatic argument, a civilized argument, but they went toe to toe on health care. And all we're asking, we understand they have the majority, and if they can get to 51, they're going to be able to enact what they want to enact. But they're so afraid of the American people finding out what's in this bill that they're hiding it from everybody, including United States senators, until the very last moment. And so that's why we're going down to CBO. I just want to say one thing about the great people at CBO. They are the referees. It is not their fault if they're unable to show us the bill. They do listen, I've gotten CBO scores back on my bills. Sometimes I like them, sometimes I hate them. But they are a nonpartisan referee that tells you what the likely impact of your bill is, which is why you've got to get a CBO score before you really even consider a bill.
And these CBO scores, they're not simple things, right? These are dozens, if not hundreds of pages. And the CBO score on the House bill told the American public that it was a disaster, that it was a piece of garbage. 23 million people losing insurance under the House bill, premiums going up by 15 to 20% for everybody, folks with pre-existing conditions, especially people with mental illness and addiction being targeted for harm. So the reason why the House bill is so wildly unpopular is because people read the CBO score, and we'd like to get that CBO score before 24 hours prior to the vote. Now, Corey's right, they're probably not going to give it to us, and we won't bring this camera in to put CBO on trial in front of Facebook Live. But the fact of the matter is that CBO score will be really important to our constituents understanding this piece of the legislation.
And let's go further, though, because we're going to the CBO to try to get a copy of a bill that exists. But when the Affordable Care Act came through, so-called Obamacare, fellas, just give folks a sense of that process compared to this secretive, behind closed doors, shuttling a bill over to the CBO, not letting the public see it, getting a score that's private and secret. What can you contrast those two processes for me?
Well, I'm kind of the senior statesman of the group, so I can certainly talk to you.
You're just saying you're the oldest?
Yeah, I can talk to you about the history of the Senate and the House of Representatives. So let me. No, I was here. I was here when this passed. It was my first term, but we had exhaustive committee processes. We considered hundreds of amendments in the House and in the Senate. The Senate itself debated the bill for 30 days, 25 days, I think, to be exact. And while Republicans like to say, oh, well, it passed in the middle of a snowstorm on Christmas Eve, that's true. But you know the reason why? Because the Senate stayed in session for 3 weeks to consider Republican and Democratic amendments. None of that is happening here. This bill is being pushed to the Senate floor with only a few hours of debate. No more than 10 hours of debate total for the whole country to see this bill. That's totally different than what
And Democrats could have defeated, I wasn't here, you were the senior statesman, Democrats could have defeated the Republican amendments, right? But how many of those Republican amendments actually got bipartisan support to become part of the bill?
Yeah, I think in the Health Committee that I sit on, the number was somewhere around 200 Republican amendments got incorporated into that bill. How many Democratic amendments are going to get incorporated into this bill?
Zero.
None.
Actually, there will be 0 amendments incorporated into the bill. I mean, we're going to go through a process called Vote-O-Rama when they drop the bill, which will be at the last minute next week. And there will be a bunch of nonsense amendments, and we'll be, sort of badgering each other. But what happens at the end of that process is that Mitch McConnell introduces something called an amendment in the nature of a substitute. So basically what that means is he's going to take every amendment that was adopted or not adopted, doesn't matter. He introduces a bill that is brand new, and it'll be adopted on a 50, probably 50 plus Mike Pence vote. And then it's the bill that was negotiated in secret with 13 men, no women, no Democrats, no experts. I mean, this is obviously the main offense here is what's going to happen to the American people. But there is another aspect of this, which is this is the most foul legislative process that I've ever seen in my 20 years of being a legislator and being in politics. This is, and even some Republicans are frustrated, but all they will do is express a little bit of frustration and then lean towards voting yes. So we got to keep putting pressure on people to understand that there are kind of two aspects of this. There's what it does to people, but there's also, don't you take any pride in the work that you do? Don't you take any pride in being on a committee and being able to work in what we call the regular order, so you can listen to experts, consider amendments, talk to your home state, and figure out how to make a bill better?
And Corey, Corey, you've made a name for yourself by reaching out across the aisle and finding a way to work with Republicans. And it's just not true that that Democrats are not interested in working together with Republicans, because we admit that the healthcare system is not fixed, right? There's still so much that has to be done, and it's not insincere when we say that we're willing to sit down with the Republicans and try to work on it.
But you said this dramatic. First of all, to Brian's point, we only need three Republicans to say this process is broken. It doesn't reflect the honor, the integrity, or the history of the United States Senate. We need 3 Republicans to say, stop this. Let's hold hearings. Let's put this through regular order. And what you're saying, Chris, is so right. This is, this is just not the way. And I've found so much common ground. There are good people on both sides of the aisle, honorable folks. This is such an affront to everything both sides have said the way they want the Senate to work. And I'm going to add one more thing, which is just this idea of what that House bill, what was most despicable about that House bill was that it would jack up the cost of health insurance for older Americans, gut Medicaid, and for what? Who would be the beneficiaries? You had a powerful chart on that yesterday, Chris. Who would be the beneficiaries?
So, this is a pretty clean bill. Hold on, we're getting out.
Yeah, you can pull, sir, why don't you go through the light and pull on that corner, sir, for us? And
wait to go through,
yeah. We don't want to. Those seem like good folks out there that are going
I don't
across.
understand. Booker got this book deal. This nice big advance for this book this bestseller that he wrote.
Are you doing an advertisement for my book, man?
I am.
No, I got the cash here. I got the cash.
United and
No.
shots.
Listen,
paying for this.
you can pull right here, sir.
I got
Too
it.
late.
No, it's too late. Oh, you paid it. You
Yeah,
put
I
it up
paid.
there. Wow.
Credit card.
Shots. What tip are you filling out? What tip are you hitting?
What's that?
Come on.
I tipped him nicely. He was very cool. And I'm sure
Isam,
this is,
we gave you a big tip there,
maybe
sir.
not your
Yeah, thank
favorite.
Isam, can I see the tip? Not that I don't trust my colleague. Are you satisfied with the tip, sir?
Yeah, I'm really good. Thank
You're
you.
really good.
Thank you, sir.
Isam, thank you very much for
Thank
putting
you,
up.
Isam.
Is this your first time you had 3 senators in a taxi?
This is my first time.
And your favorite state,
is it-
Hawaii, Connecticut, or New Jersey? New Jersey is your favorite state, right?
New Jersey.
Yeah, all right. Thank you very much.
So, I think pretty soon we're going to want to turn off the Facebook Live just in a few minutes because we want to respect the integrity and the privacy rights of these great federal officials. So what we're going to do is we're going to go in, we're going to have a conversation with CBO, and then we're going to log in and tell you how it goes and talk a little bit more about what we need
Now,
to do about
400,
healthcare.
401 E Street, while we're here, is there anything else that's the Consolidated Forensic Laboratory over there. Is there anything we need from the Consolidated Forensic Laboratory?
Not yet.
Not yet.
We'll see how the bill goes.
We'll see how the bill goes. And which one is the Hyatt Place? Is a hotel right there?
I think we're across the street.
We're going across the street. Okay, well, let's keep walking.
For our cameras, can you explain to me what are you trying to do? What are you doing?
Go ahead.
So right now there is a bill that's in the works. It's been in the works for weeks, many weeks. It's being done in private, in closing, in secret, behind closed doors. A handful of Republicans, in fact, not all Republicans, we've heard from frustrated Republicans, have seen this bill. And so what we want to do is see the bill. The American public deserves to see a bill that's going to affect tens of millions of people. There's been no hearings on this bill. There's been no input from specialists, experts, doctors, nurses, advocates. This is an offense to the way the Senate should function. And so what we're going to do, it's an outside chance. We're probably not going to get the bill, but we're right now going to march into the CBO building and ask as nicely as possible. Maybe they will show us a copy of this secret bill so that we can bring it out and send it out to the public.
Can you talk about your approach with social media?
Well, look, I think this is an opportunity for 3 senators to try to shine out the spotlight on the absurdity. I mean, this really is an exercise in the absurd, right? That we have the United States Senate about to pass legislation or vote on legislation that affects such a tremendous part of our society. Literally, this country impales this idea of life, liberty, and the pursuit of happiness. Life, that's a fundamental aspect of protection of life, the elevation of life. And here, healthcare is at the center of that. We're about to vote on a monumental bill within days, and no one has seen it. And so what we're trying to do is demonstrate the absurdity of that. Here you have 3 senators standing on a street corner before the Congressional Budget Office, and we're going to march in there and try to get a copy of the bill. America deserves to see this bill.
Okay, I'm going to try to go with you guys, see how far I can go. And
Great.
Thank you.
All right, here we go.
All right? You're not going to try to get us to jaywalk, Murphy, are you?
No. We got 35 seconds left here. We got plenty of time. And here's the thing: we've asked for the bill from Republicans. We've asked to be part of these meetings. We've sent them letters. We've talked to them individually. It's not as if we haven't begged our Republican colleagues to be part of this process. We wouldn't be doing this if we hadn't already been shut down in every way possible by the Republicans.
Absolutely. And so, which building is it, man? Is it this one on
I
the
think it's
left?
this one on the left.
Because I love that sign over there. I wish people could see it. It literally says NASA shuttle parking only.
I don't know that's the shuttle you're thinking of.
I confess that I have not been in this part of Washington, D.C. It's exciting. Forensic science, NASA is over here, and the CBO.
And we don't often get down to this part of the city, but we are forced to today because it's the
Yes.
only way that we are potentially going to get our hands on this piece of legislation. So we're right here, right?
Yes.
All right.
As a Giants fan, I don't think I can go into Patriots Plaza, but is that literally the place we're going to go?
I'm not too sure.
I'm not too sure either.
I think we need to sign out, call our staff.
Well,
figure
why
out
don't
where
we
we're
want the
going.
public to see the fact that we don't know exactly where the CBO building is, and you think it's over there? Let's call the staff. Let's keep this running for a second. How are you, sir? You doing all right, man? All right, I'm good.
We don't want to walk into, like Panera and demand to see the healthcare bill.
We would like to see the healthcare bill. Maybe Panera probably has an equal chance that we have of getting the bill, of actually seeing the healthcare bill. So Brian Schatz is over there doing what we do, we senators do all the time, is when we don't know something, we call our staff members, who generally have a better grasp on the larger workings of the Senate.
Yeah, but everybody, thinks that we, roll with these big entourages.
This is
It's just the 3 of us.
It's the 3 of us and my man on the camera back there, and a bunch of really kind people trying not to be on TV right now, and we're embarrassing them completely. Okay, so we are going to sign out now. We now have we have the coordinates. So we are going to sign out,
And we'll be back.
and we will be back afterwards. I hope you'll tune back in.